Welcome back. In our last lesson, we explored communication skills and how to build trust with patients. We learned that effective communication creates safety and that trust opens the door to healing. Now that we've established how to connect with someone, we move to the next step, assessing their mental health condition. This doesn't mean making a clinical diagnosis. As non-specialists, your role is not to label someone. It's to observe, ask the right questions, and recognize when someone may need help. Let's walk through how to do that clearly, calmly, and compassionately. Why is assessment important? Because most people don't say, "I think I have depression." Instead, they say things like, "I feel tired all the time. I've lost interest in everything. Something just feels off." Without structured observation and sensitive questioning, these signs might be missed or dismissed. A good assessment helps you understand the person's experience, identify possible symptoms, decide whether immediate support or referral is needed. Step 1. Observe carefully. Start with what you can see and hear. Is the person withdrawn or restless? Are they speaking very fast or unusually slow? Do they appear disoriented or confused? Is their personal hygiene noticeably poor? Are they showing signs of extreme sadness, fear, or irritability? Body language, speech patterns, and behavior can give you valuable clues, especially when the person is not yet ready to speak openly. Step 2. Ask open-ended questions. Once rapport has been established, gently ask questions that explore how they've been feeling. Use everyday language. Avoid labels. Here are a few examples. Can you tell me how you've been feeling lately? Have you been having trouble sleeping, eating, or focusing? Have you lost interest in things you used to enjoy? Do you sometimes feel hopeless or overwhelmed? If someone shows signs of distress, follow up with specific but non-threatening questions, such as, have you had thoughts about harming yourself? Do you ever hear or see things others don't? Have you been drinking or using substances more than usual? Always ask these questions in a calm, private setting and at the person's pace. Step 3. Explore duration and impact. Symptoms become more concerning when they are persistent and disrupt the person's ability to function. You can ask, how long have you been feeling this way? Is it affecting your work, relationships, or daily activities? If symptoms have lasted 2 weeks or more and are interfering with daily life, it may be time to involve a trained mental health professional. Step 4. Know when to refer. As a non-specialist, you're not expected to treat everything, but your ability to recognize signs early and refer when needed can be life-saving. Refer immediately if the person is expressing suicidal thoughts or has made an attempt. There are signs of psychosis, such as hallucinations or paranoia. The person is not responding to basic support over time. There is risk to others, especially in cases of aggression or confusion. When referring, do so with care and dignity. Explain that they deserve specialized support, just like someone with a physical health condition would. Let's pause for a moment of reflection. Have you ever spoken with someone and had a feeling that something wasn't quite right, but didn't know how to ask? How might these tools help you next time? Being prepared with the right words and a calm presence allows you to move from uncertainty to action. A real-life example. Fatima, a market vendor in Kano, has been avoiding her stall and missing community meetings. When her neighbor gently asks what's wrong, she says she feels empty and has stopped eating. The neighbor, a trained non-specialist, listens carefully, notices that Fatima speaks slowly and has tears in her eyes. She asks how long it's been going on and learns that it's been over a month. With her permission, the neighbor refers Fatima to a local health worker trained in MH-GAP. Fatima later says that simple conversation saved her life. In summary, assessment is not about labeling. It's about observing, asking, and referring when needed. Pay attention to changes in mood, behavior, and functioning. Use clear, respectful language explore how long symptoms have lasted and their impact, know when and how to make a referral. In our next lesson, we'll look at how to support people beyond the assessment phase by offering psychosocial support and crisis intervention. We'll explore what to say and do when someone is in emotional pain and how to be present in moments of distress. Before we go, here's something to reflect on. If someone opened up to you tomorrow, would you feel confident knowing what to ask and how to respond? What's one thing from this lesson you can begin practicing right away? Let's continue building our skills, one conversation at a time.